My name is Charlotte Mather-Taylor, and I'm the Executive Director of the Area Agency on Aging of Broward County. We are a nonprofit organization. We plan, develop, coordinate, and evaluate programs, provide services, fund services, and are the prime advocate for Broward County residents 60 years of age or older. This video is brought to you by our Dementia Care and Cure Initiative Task Force, also known as DCCI. The DCCI Task Force is part of the Florida Department of Elder Affairs statewide network of task forces committed to creating dementia caring communities throughout Florida. One of our goals is to increase education, awareness, and sensitivity regarding the needs of people living with dementia and their caregivers. We hope this video will provide you helpful information to assist you in caring for your loved one. If you have any questions regarding this video or are seeking resources, please feel free to reach out to one of the phone numbers behind me on the screen or our website at www.adrcbroward.org. Thank you.
My name is Milena Cedeno-Oblinger. I am a registered nurse and certified dementia practitioner at the Memory Disorder Center at Broward Health North.
I'm Jean Merget. I am a social worker here at the Memory Disorder Center, and I've been a social worker for 31 years.
So we're here to talk to you about the Memory Disorder Center and how we can help. The Memory Disorder Center falls under the Alzheimer's Disease Initiative. In 1985, the Florida legislature launched the Alzheimer's Disease Initiative, an integrated system of dementia-specific services to address the current needs and prepare for increasing numbers of Floridian residents with Alzheimer's disease and related disorders. Florida has a wide infrastructure under the Department of Elder Affairs that provides diagnostic and clinical care, education, support, referrals, community outreach, and research for families dealing with Alzheimer's disease and related disorders. So where does the Memory Disorder Clinic fall under this infrastructure? The Memory Disorder Clinics are at the foundation of the Florida-wide Alzheimer's Disease Initiative. An integrated approach is the ADI network of the memory disorder clinics. So the memory disorder clinics work together to review best practices and strategies for helping our residents in our areas. The MDCs provide a continuum of services throughout the entire state to meet the changing needs of individuals living with Alzheimer's disease and their families, or caregivers, through complete evaluation, treatment, education of family and professional caregivers, research on brain function, the disease process, and possible cures, and strategies to improve care and treatments over the long term. Jean, can you chime in on how the memory disorder clinics differ from maybe a different type of evaluation for memory?
What we do is we try to pull the team in together, and we work with families one-on-one, which it doesn't happen when you go to, let's say, a neurologist's office. We provide services, we provide education, we provide training for the caregiver, which really is one of the most important things in this whole picture, because we keep on telling the caregiver that they are the most important person in this picture. And we want them to have the capability of being good caregivers as well as taking care of themselves. And that's really a difficult task to do, especially when they really didn't come into this with the education necessary. So we really take our caregivers and we turn them into experts.
So a part of the infrastructure provides for additional resources that may not be found in a usual neurologist's office. Although the neurologist may be able to make the diagnosis with the assistance of specialists, they really need to help that individual put together a care team of supportive services to refer out to community-based services and additional education and training. And that's what the Memory Disorder Center is here to do. So when should you seek a diagnosis? So there are some early signs. A lot of times, and Jean can probably agree with me, we get individuals that come to this center when those symptoms are impacting the daily life and the daily living. They're not mild, they're moderate symptoms, and they've really made a huge impact and affect that individual's life. And especially here in Florida, where we have seniors living alone whose children are out of state, it may go unrecognized for maybe months to years before you realize that there's a problem. But there are some early signs of memory decline that you would want to seek a diagnosis. Forgetting the time of an appointment or forgetting appointments, forgetting whether a task was done already, such as paying the same bill twice, forgetting the location of keys and eyeglasses, your wallet, your favorite slippers. These ordinary household items that you use frequently are now being misplaced or put in strange places that they don't belong. Forgetting the credit card after a store purchase. Other early signs of language decline can be not recalling the names of a favorite fruit or the city where someone was born, family members, close ones, not understanding others, so not understanding information coming in, and using a related but wrong word when speaking or writing. So even the language that's coming out does not sound fluid or it does not sound normal. Early signs of general thinking decline can be difficulty in planning, difficulty making decisions or choices, difficulty carrying out all steps to a task. So sequencing becomes an issue and carrying out tasks that you were otherwise able to perform. Why seek a diagnosis? So I know that Jean works with a lot of families. And maybe there are some hesitations. What types of hesitations have you heard, Jean, from patients not wanting to seek a diagnosis?
Well, from the patient themselves, they don't feel that there's anything wrong with them. That's the first thing that I hear. They don't know why they're here when they're brought in. And lots of times caregivers are hesitant because they might have contacted their primary physician and the primary physician says, well, you know, they have a little bit of a memory problem. It doesn't seem to be impacting on their life, so we'll keep an eye on them. So they're listening to their primaries. The primaries aren't always that proactive, so that's why a diagnosis is put off. And then too, they're afraid to hear the diagnosis if there is a problem, because then they know that they're part of what's going on and they have to do something. So
Right.
there are a lot of different reasons why they don't jump into a diagnosis.
So seeking a diagnosis to determine if the symptoms you're experiencing are truly due to Alzheimer's disease or some other perhaps treatable conditions. There are some treatable conditions to memory dysfunction that can be ruled out and managed and treated. Sometimes the individual will go back to their prior functioning, and sometimes they may stay the same through the course. But if Alzheimer's is the cause, that's a progressive disorder and it will continue. And an early diagnosis may allow you to access treatment options that may lessen the symptoms, maybe give you longer time with your family. An early Alzheimer's diagnosis provides you with a better chance of benefiting from the treatment. You know, the treatment that we have now really works best if started early and may give the individual an opportunity to slow down the progression of the disease. There is no cure for Alzheimer's disease, but starting treatment early may have some additional benefits. An opportunity to participate in clinical trials. An early diagnosis makes individuals eligible for a wider variety of clinical trials, which advance research and may provide benefits. Also a chance to prioritize your health. So there are some Modifiable lifestyle changes, such as controlling your blood pressure, stop smoking, participating in exercise, staying mentally and socially active, may help preserve some of the cognitive function. Mild cognitive impairment, this is the hot topic, the big word in the street. It's mild memory problems. There are some treatable causes to memory problems, such as low hormone levels, depression, high anxiety, fatigue, high amounts of stress, or even a mild infection that would temporarily impair the memory. When these conditions are treated early enough, in many cases, the memory ability returns. So again, if you notice signs and symptoms of memory loss, it's not always Alzheimer's disease, but seeking an early diagnosis may have great benefit. So Jean and I here at the Memory Disorder Center value the team approach. The team approach is what we do best. Again, it's a little different than just going to your primary office or maybe your neurologist. There is a team of health specialists here that offer a range of skills such as medical, psychological, and social services. You know, we call this the caregiver's disease because the caregiver is so highly affected in all areas of their lives. They need the supportive services, but they also need those questions answered and the social services and training. Sometimes even therapy for the caregivers or even the individual themselves. And that's where the psychological services also come into benefit. Case conference format. So Jean, as the social worker and family counselor, would join the results conference, and that case conference format would include the person undergoing the evaluation, at least one family member or significant other, and other appropriate people like Jean, the family counselor, the social worker, the doctor, sometimes the psychologist, because it takes everybody and it takes a village really when it comes to progressive memory loss. The case conference should cover the health condition, the care plan, with suggested treatments, follow-up services, and resources in the community to help the family. What types of resources, Jean, have you found to be imperative?
Well, for a person that's diagnosed with a dementia, the best thing that the community has to offer are our daycare programs. And that helps the patient as well as the caregiver. It empowers the patient. The patient has a schedule, they look forward to going, they have socialization, they have activities, they have everything that they need under one roof. The caregiver, on the other hand, has peace of mind because they know that they're being well taken care of and they can do the things that they have to do for themselves. It's a break for them. It's time to get their whatever they need to have done. And it's a safe way of caring for the patient. It's economical and it's the best care that the patient can get during that time.
So respite is vital. And
Very.
so that's one of the areas of expertise where you can help develop the plan of care and put these resources and services into place based on an individual plan of care, individualized for the person undergoing the evaluation with dementia, with Alzheimer's, and the caregiver. So there are some medical tests, of course. There's no single diagnostic test that can determine if a person has Alzheimer's disease. Physicians, with the help of specialists such as neurologists, neuropsychologists, geriatricians, and geriatric psychiatrists, use a variety of approaches and tools to help make a diagnosis. They're going to need medical history. They need a mental status test. So Jean usually starts off the new visit with a mental status exam. There's a physical exam and other diagnostic tests, also brain imaging. The physician needs to look at the structures of the brain to rule out other things, again, that could be causing memory problems. Tumor, stroke, and also a thorough neurological exam. That's what you can expect when you come to get an evaluation at the Memory Disorder Center. Now, what do we do after a diagnosis? So Jean definitely is the expert at care planning and vital. She's a very vital part of the team. And I know that caregivers that attend the care assistance program at the Memory Disorder Center would agree with that. So once testing is completed, the doctor will review results and share conclusions. Some good questions to ask at this visit, at the results visit, is why the diagnosis is Alzheimer's? Why is it not something else? How do we know it's Alzheimer's? Where you and the person living with Alzheimer's may be in the course of the disease. So we said Alzheimer's is a progressive neurodegenerative disease. So where are we? Are we in the mild stages? Are we in the moderate stages? Are we in the more severe stages? And how do we plan for that? What do we expect if we're in the mild stages? What should we expect for the moderate stage and the severe stage? We need to find support. So what types of support do you offer the caregivers after the diagnosis, Jean?
Well, the most important is they have our phone number, and they reach out to us. We'll tell them, we lay out a plan of care, but sometimes they're a little bit reticent to start right away, and then they have to wait to see if there are a few more signs, if they need more help. But the phone is the most important part of this whole care plan, because then they open up, they tell me what's going on, we problem solve over the phone. They can come in and for a visit, and we can do that here in the office. It's very, our communication is there. The caregiver is always, will always have help from me and from the rest of the team. We all know our patients. That's what's beautiful about this. I don't think there's anyone here that doesn't know our patient, our caregivers, and what their needs are. And that's what makes us so successful in helping the caregiver as well as the patient. So, you problem solve, they'll call up, they'll tell me what's needed, and then we problem solve together to see what the most effective care for that person is at the time.
So we are an extension of the care team. And also we offer support groups. So, finding a support group, even if it's not through the Memory Disorder Center, locally to you, even if it's virtual or in person, which during COVID has been a challenge to have support groups held in person. But the support group for the caregiver is not only speaking with the clinician, but speaking with individuals who are going through the same thing you are. I've learned so many tips from our caregivers in our support group, right, Jean?
Oh,
just
yeah.
trial and error with different issues, maybe sleep disorders or, trying to go to a restaurant. I've learned some great and wonderful things from our caregivers in our support groups. And the loving camaraderie that they have, even when a new person comes in, they right away just rally around that person. And so a support group is vital, I think, to caregiving.
Well, they value that because it's like you said, it's an extension of family for them. They don't really get that much help from their families many times. Their families are in denial. The family support group is not in denial, and they can really help them and tell them what to do in a lot of the situations.
Or sometimes family members are more toxic.
Yes, they are.
Yeah, and you need that emotional support because you're the person who's being proactive and getting things done, where the toxic person keeps butting in but is not really doing any of the work. And so, I find that that has been helpful to some of our caregivers as well, being that emotional support. And again, just rallying around them that what they're doing is a great job. Training and education is really important. Understanding the disease, understanding how the medication works, behavior management strategies. So training and education is another area that, another program that we provide at the Memory Disorder Center. Not only do we train professional caregivers, but we train the family caregivers as well through the Care Assistance Program. And so the area agency helps to fund that, and we provide education workshops to our family caregivers so that they can best be equipped with the tools that they need. And I don't know, do you have any great stories around the Care Assistance Program, Jean?
Well, it's just amazing the transition that they make when they're first, caregivers, and they really have no education and no training, and then they come to the program, and they can't thank us enough for what we provide for them, because it's just amazing how they blossom as caregivers, and they're not afraid to tackle the disease and to give the best care for their loved one, because they didn't know before. They didn't know what's available. You really, you're at the mercy of the community, and a lot of the community does not know what services are available. We have wonderful services out there. Just counseling, just telling them what they can do for themselves to help themselves. Caregivers always put themselves to the side, and the focus is on the patient. Well, we try to take that focus at least partly away from the patient and put it on the caregiver, who really needs that in order to be successful. So they are so happy to have come to our program. And we don't even almost have to advertise it. We have our caregivers out there in the community telling them how great our program is. And I get calls all the time saying that they were referred by another caregiver to our program. So to me, that's the success of a program.
Right, that's the testimony. And then last but not least, plan ahead. So you have to have a plan of care that is individualized to the patient with dementia or Alzheimer's and to the family and the caregivers, so that everybody can work as a team if it's possible to do that. But have a plan in place so that you know where the finances are going to come from, have the legal documents in place. What about the long-term care, the advanced care planning? So having a plan is, it sort of seals the deal. And that plan, know that that plan will continue to change and evolve. That's one thing that I've definitely learned working with this population, is that, you have to be flexible. You've got to go with the flow and know that nothing stays the same. Everything is changing, and it continues to evolve. And so rechecking in with the team to see where we are in the plan and what do we need to change and what needs to be adjusted is an ongoing process. And we just want to thank you for your time. We hope that we helped get you on the right track. I hope we answered some questions maybe that you may be having, maybe seal the deal on some hesitations that you may be sitting and thinking about. And know that we are available. Know that Jean loves her job and she loves helping people. And that we, as the team here at the Memory Disorder Center, look forward to meeting you if we haven't yet. Thank you.
We hope you have found this video educational. Remember, you are not alone, and there are many resources out there to help you. The next slide lists some very important resources that you can connect to seek additional assistance. In addition, Remember, the Area Agency on Aging of Broward County is here to help. Our phone number, which is behind my screen, is 954-745-9779, which is our direct helpline, as well as our website, www.adrcbroward.org. Wherever you live in the state, you can reach out to also the 1-800 number also behind me on the screen. That's 1-800-963-5337. That number will connect you to an area agency on aging in your area. Thank you.